going to find out from one of the greatest hepatitis B advocates in our country of what we can do and what are our marching orders from Michaela. Michaela is the program director of prevention and policy at the Hepatitis B Foundation and plays a leading role where she spearheads efforts to expand hepatitis B awareness, testing, vaccination, especially the crucial birth dose, and linkage to care, focusing on high-risk communities and influencing federal state policies to eliminate hepatitis B in the U.S. She is a key public health advocate, as I said, working on research coalitions like Hep B United and media to fight viral hepatitis. I'd like to welcome Michaela. She is a rock star. So she's going to give us our marching orders on what we need to do to protect everyone in Oregon, even though, thank you, West Coast Alliance, for your great work. Michaela,
Thank
you there?
Yes, absolutely. Thank you so much, Lauren, for that incredibly warm welcome. I don't know if I can live up to your high expectations, but I hope I can. So thank you all, first of all, for having me. I know Oregon and all the advocates on the ground are doing such a fantastic job and have been really involved in this process. And I was listening to the other presentations, so I do kind of give a little bit of an overview of what happened in ACIP. I break it down in layman's terms. I promise I'll be quick about that since I know Dr. Hall and several others, kind of went over that. And I do want to give a huge shout out to Dr. Hall and his team for the modeling research they did. It was an incredibly huge help to have numbers and data to apply to the potential scenarios prior to the actual ACIP vote, so people can actually see what would become of the vote and the reality of it. So really appreciate all the work that his team did. So for those of you who haven't had an opportunity to watch, this was a very long meeting, so I wanted to kind of go over some of the other things that happened outside of the vote that I think are really key for us to understand. So the first thing that everybody's been talking about, there's no more universal hepatitis B birth dose as a federal recommendation. Obviously that has implications that we'll talk about later. But I also want to kind of talk about some of the language that was being used. So the first day was kind of a surprise, I think, to a lot of advocates if you didn't have an opportunity to watch. There was a very, very heavy emphasis on immigration and immigration being a cause, and foreign-born individuals being the cause of hepatitis B in the United States, essentially. And this was something that came as a surprise because prior to this, ACIP had not mentioned any sort of groups who are at higher risk or anything like that in their conversations around the universal birth dose. And so I think a lot of advocates kind of hoping that we wouldn't have to address this hurdle or kind of jump over it and that ACIP wasn't going to touch it since they hadn't discussed it for the entire year prior. But unfortunately, there was very heavy evidence on kind of this chronic hepatitis B in the United States, and we don't need to worry about babies getting it because it's only foreign-born individuals who are living with it, and they're the most at risk. So unfortunately, there was a very heavy discussion, um, essentially trying to separate Americans versus foreign-born in immigrant groups, which was very uncomfortable and disheartening to see. There were speakers who directly said that hepatitis B is a virus only given or only for drug users and homosexuals, so why do babies need it? Those are exact words that they use, not mine. And so, really, we're seeing a rise in this stigmatizing language around hepatitis B that has always been there, but we've never really talked about it in the sense of the universal birth dose because I think we all agreed that preventing hepatitis B in babies and, liver cancer from the start at birth was something that was fantastic and what we would want to do. But now I think as advocates, we should all really be aware that these are words that are being thrown around in this context, and we might see more questions arising from that. In ACP, something that they did that was very unfortunate for us, but very beneficial, I think, to them, is that they spoke directly to parents. Several ACP members said, parents, and were kind of directly addressing them during their speeches and saying, parents should be doing this, parents should be talking to providers, parents should be doing that. And that is something new for ACIP. Typically, ACIP looks at the data, they look at the numbers, they don't speak to the audience, they don't question the audience that's on the other side of the camera or have anything to say to them. They speak amongst the group and within each other. So it was definitely a jarring shift to see that. I'm sure, everybody here probably has heard about or saw, there was definitely a lack of transparency and data on supporting the changes, specifically Vote 2. We've been getting a lot of questions around Vote 2, which I will address in just a bit. But just the lack of data to actually support their claims was brought up by Dr. Meisner several times. So it's not necessarily the fact that we're kind of questioning universal birth dose or saying that nothing needs to be changed. It was that there was absolutely no evidence and no data to support changing it at this point in time. And all the evidence, as was stated by several ACIP members, did point to potential harms. And then finally, just for the advocates, I know a lot of you guys have involvement or have spoken with Senator Cassidy, and his office and his team. He has come out on the first day of the ACIP meeting when they were having these discussions about immigration and about who is most at risk for hepatitis B, and called for the CDC acting director to reject the final votes for the universal hepatitis B recommendation. So I think this was the first time we saw Cassidy speak so boldly um, about the ACIP. He basically denounced them. He used some pretty strong language that we hadn't seen previously in the year, which was good to see, but unfortunately, I don't think it's going to carry much weight with Secretary Kennedy or the acting director. So what does all of this mean? On the next two slides, I kind of just do a very quick breakdown of how we should be interpreting these votes. The language is very messy. The language is very confusing. I don't think that was unintentional on their behalf because they're really, in my opinion, banking on this language to be confusing. So that it's kind of easier just to say, you know what, maybe we shouldn't give the birth dose at all. But essentially, the first vote, they agreed to only recommend the hepatitis B birth dose to babies born to mothers living with hepatitis B. This is a very clear risk-based recommendation. And the reason why I want to say that is because we already tried the risk-based recommendations in the 80s. They failed us. So it is not a far conclusion to kind of say this is not going to work when it comes to implementing it in 2025 if it already failed us previously. But then what it also does is say, and they use the word suggest instead of recommend, but they say that babies born to mothers who don't have hepatitis B should basically begin the series at 2 months of age. So a lot of people are going to read that and say baby should start the series at 2 months of age. That is not necessarily what has to be done, though. The second vote, which is one we've been getting a lot of questions about, is basically suggesting that only one dose of the hepatitis B vaccine is needed. And if a doctor and a parent wants to determine whether or not a baby should get additional doses of the vaccine, they should conduct a blood draw on the baby. Um, I think we can all kind of hear just saying that out loud. It doesn't sound very practical when you're talking about the sheer amount of babies that are being born each year, but also one of the things that they are kind of the imagery they've kind of alluded to is, we're doing harm by vaccinating these babies. We're pricking these poor infants with needles, and now we're telling mothers to and fathers to go get their baby poked to get their blood drawn around the same age just to get a vaccine potentially. It doesn't quite make sense. It's not very practical, and a lot of people will not do that. They also said that the cost of testing these infants should be covered by insurance. I do want to make it very clear, ACP does not have jurisdiction over insurance coverage for testing for hepatitis B. That is not their wheelhouse or their purview. Um, but also the fact that there is no evidence to support that fewer than 3 doses leads to long-term protection against hepatitis B. And I think we've gotten a lot of questions from media, from parents, and things like that. And that's the most important part, is that there might be studies comparing 2 doses and 3 doses for children, but there are no studies that are saying that fewer than 3 doses leads to long-term protection. And that's what we want. The hepatitis B vaccine, when it's done in 3 doses, has been proven to be effective for over 30, close to 40 years. So it's a lifelong vaccine if you complete all 3 doses. Less than that, we have no evidence to say that it will lead to full-term protection. But finally, I think this is one of the things that we really want to highlight is that despite what the recommendations now officially say, and despite the fact that we had no longer have universal birth dose on the federal level, all parents can continue to vaccinate their newborns at birth using the 3 dose series because of kind of what Rex alluded to before, the way that it's written with shared clinical decision making. If a parent wants it, they can. And I think that's one of the most important messages that we need to be getting across. I think we already touched on the insurance coverage part of it. Yes, it will continue to be covered under both commercial and federal and state plans based upon the way they wrote their language. So what happens now? The most important thing that I think that we can do as advocates, as health departments, as anybody in this room, is really to make sure that we have very, very clear messaging about hepatitis B, its consequences, and the fact that parents can still get this and all 3 doses fully covered for their child if they want it. If parents are reading what's going on, a lot of the headlines are saying to you, we've removed the universal recommendation, and that's great. It's true, but it's also a little bit misleading in the sense that it's gone, but it's accessible still. So accessible, I think, should be our favorite word for as long as this policy and this recommendation is in place. So really, birth dose is needed. You need to complete the full series, and you can still access it right now. Educating pediatricians and parents about hepatitis B in general is going to be really important. I think we all understand how important it is, but there's also a million things that a pediatrician has to address a day with just one child. So um, making it as easy as possible for pediatricians to be able to answer new questions that they will be getting about the birth dose. We've gotten this a lot this year. Just pediatricians have never really had to think about how to defend this vaccine because it's been so routine. So now they're getting bombarded with questions and they don't quite know how to answer them. So having advocates and people able to assist them in that, whether that is just factual information, guides you've already created, handouts are already created, and saying, here's a resource for you, or whether it's kind of like a webinar for providers that just goes over the importance of the birth dose and why we give the birth dose. Anything like that, I think, is incredibly helpful during these times. But also for high-risk groups. I'm not entirely sure what you all have seen in Oregon yet, but I do know several other states have reported to the Hepatitis B Foundation prior to the vote even happening, mass confusion around if the birth dose, why it was important, but also high-risk parents, so people living with hepatitis B, coming to us and saying they don't want to vaccinate their child for hepatitis B anymore because they heard it's unsafe. And so we need to make sure that we're getting the message out there that this is a good vaccine, especially for those groups who we know have an incredibly high risk. And really just work on affirming evidence-based science and issue really clear guidance. So I know you guys are on top of things in Oregon. On the left of the screen, you can kind of see some other states and cities specifically that have already come out reaffirming the fact that this is the universal birth dose is important and that they're going to continue to follow universal guidance because that is what the data says. And I think the more that we get that message across, the better it is. It doesn't matter what platforms you're using, local media, national media, whatever you can do, the more we get this message out there, I think the more it becomes clear that what ACIP did was not founded in evidence and data, and we should not be following those recommendations. So those are just kind of immediate steps. I think we do have a very long road ahead of us regarding, you know, the childhood schedule in general. A lot of things were said on day two, specifically comparing the United States to Denmark's childhood schedule, not just specific to hepatitis B, but also the increases in discussion around autism and vaccines and hepatitis B. One of the things that was brought up was SIDS. Everything that has basically been debunked in the past is coming to light. But unfortunately, these are really powerful things that parents are hearing, and it's enough to raise a little bit of doubt. And with vaccines, there's not a lot of time to cast this doubt. We want it to be given in a timely manner. So making sure that everybody has the correct, appropriate, evidence-based information is going to be key. And it seems really simple, but unfortunately, we've kind of gone back to the basics, and just basically defending what we already have. One of the things I actually did not put on this, but I do think will be very critical is, I think all of you know, but in 2022, the CDC did vote to have a universal adult hepatitis B vaccination recommendations, also universal screening for adults now in 2023. I think these two, and making sure that they're implemented well, um, increasing any efforts around that you might have been doing will be really, really helpful to us in the future. Now that we have this potential gap in, infant recommendations and infants getting hepatitis B vaccination, we really need to make sure that we are increasing all that we can to get others vaccinated as well so we can protect all communities against this. So I just wanted to acknowledge some of my team members very quickly who have been working very closely with me on this. Monique has been doing a lot of our communications, and I'll drop our communications in the chat, our president, Sherry, and our communications officer, Ed. But here's my email if anybody wants to reach out or has any additional questions. But with that, I'm happy to turn it back over to the moderators.